10 early stroke warning signs most people miss. Most people imagine a stroke happening without any warning, a sudden collapse that comes completely out of nowhere. But in many cases, that's not how it happens. The body often gives subtle clues days or even weeks before a major stroke occurs. Before we begin, it's important to note that this video is for educational purposes only. It isn't meant to diagnose a medical condition or replace professional medical advice. If you notice any of the symptoms we'll discuss, or have concerns about your health, please speak with a qualified healthcare professional as soon as possible. In this video, we'll explore 10 possible warning signs of a stroke. Some are well known, while others are surprisingly easy to overlook. In fact, one of the final signs on our list is something many people dismiss as completely harmless, even though it could signal that something serious is developing. So be sure to watch until the end. You might learn about a symptom that could make all the difference. A stroke occurs when blood flow to part of the brain is interrupted or significantly reduced. Without a steady supply of oxygen, brain cells begin to die within minutes. But despite what we often see in movies, a stroke doesn't always begin with a dramatic emergency. Sometimes the earliest warning signs are so mild or short-lived that they're mistaken for stress, exhaustion, dehydration, or even a migraine. And because they seem to disappear, many people ignore them. One of the most important things to know is that some people experience brief episodes of stroke-like symptoms before a major stroke. These are called transient ischemic attacks, often referred to as mini-strokes. A TIA can last just a few minutes before the symptoms completely disappear, leaving the person feeling perfectly normal again. But that temporary recovery can be misleading. A TIA is often the body's way of warning that a more serious stroke could be on the way. That's why even symptoms that come and go should never be ignored. It's also worth remembering that strokes don't affect everyone the same way. Different parts of the brain control different functions, such as speech, movement, balance, vision, memory, and swallowing. The symptoms depend on which area is affected. One person may suddenly struggle to speak, while another may experience dizziness, blurred vision, or an unexpected change in behavior. This wide range of symptoms is one of the main reasons strokes are so often misunderstood or recognized too late. Now, let's take a closer look at the 10 warning signs you should never ignore. Number 1. Sudden weakness or numbness in the face, arm, or leg. This is probably the most well-known stroke symptom, but many people still brush it off. It usually affects only one side of the body. A person might notice their hand suddenly feels weak while holding a cup, or they might feel one side of their face sagging slightly. Sometimes the weakness is so mild that the person just feels clumsy reaching for something, as if the hand doesn't quite feel like their own. Some patients dismiss the feeling by saying, "My hand just went numb, it's nothing," because numbness is often seen as an ordinary, everyday sensation. Let's imagine a 67-year-old man named Robert. One morning, while drinking his coffee, he noticed he was having trouble holding the cup with his right hand, but he blamed it on a poor night's sleep. Half an hour later, his wife noticed that the right side of his face had drooped slightly, and they went straight to the emergency room. What's notable about Robert's story is that the first symptom seemed fairly mild on its own. The real warning came when a second symptom appeared shortly after. This kind of sudden weakness affecting one side of the body can indicate that blood flow to a part of the brain has been interrupted, and it's important to get it evaluated as quickly as possible. Experts suggest, as a simple way to notice something's wrong, having the person raise both arms at the same time and checking whether one side drifts down compared to the other. Of course, this isn't a diagnostic method, it's simply a way to raise awareness. Some patients don't even notice this weakness themselves. It's often a family member who notices, maybe during a handshake or when handing something to that person, that their grip isn't as firm as usual. These kinds of outside observations can provide a much earlier warning than the person's own awareness, which is why paying attention to small changes in the people around us can be just as valuable as noticing changes in our own body. Number 2, sudden difficulty speaking. Words suddenly becoming slurred, trouble forming sentences, or difficulty understanding what others are saying. These are all signs worth paying attention to. Sometimes a person knows exactly what they want to say, but the words come out jumbled, as if the connection between the brain and the tongue has momentarily disconnected. In other cases, the person uses entirely correct words, but their pronunciation becomes blurry, as if their mouth has gone numb. This can last just a few minutes and then resolve on its own, which is exactly why people often don't take it seriously. Someone who suddenly mixes up their words during a phone call and then returns to normal usually blames it on tiredness or a lapse in concentration. But the fact that it's temporary doesn't mean it's unimportant. On the contrary, these kinds of brief episodes can sometimes be the first sign of something bigger to come. This symptom deserves extra attention, especially when it occurs at the same time as the arm or facial weakness we mentioned earlier. These two signs together carry much more weight when considered side by side. Number 3, sudden vision problems in one or both eyes. Sudden blurriness, dimming, or double vision is often mistaken for an eye problem. But when this symptom appears suddenly in just one eye, the cause may not be in the eye at all, it may be in the brain. Some people describe it as if a curtain has suddenly dropped in front of their eyes. Only part of the visual field may be affected, or the entire vision may become blurry. Let's take Margaret, a 73-year-old woman. One afternoon, while watching television, she noticed part of the vision in her left eye starting to go dark. It cleared up after a few minutes, and she blamed it on tired eyes. When the same thing happened again the following week, her daughter insisted she see an eye doctor, who immediately referred her to a neurologist. This kind of temporary vision loss can indicate a brief disruption in blood flow to the brain's vision center, and it absolutely needs to be evaluated. It's also worth mentioning that vision problems sometimes occur along with dizziness. When these two symptoms happen at the same time, the situation deserves even more attention. Some people also describe only the upper or lower part of their visual field being affected, as if a curtain has dropped halfway. This kind of partial vision loss can become especially noticeable while driving or going downstairs, because the person can no longer see an area they would normally perceive automatically. This can be a small but meaningful clue that shows up unexpectedly during everyday moments. Number 4, a sudden and unusually severe headache. Everyone gets headaches from time to time, which is why this symptom often gets dismissed. But we're not talking about an ordinary headache here. This is a sudden and intense pain unlike anything the person has ever experienced. Some patients describe it as the worst headache of their life. This pain typically reaches its peak intensity within seconds, unlike an ordinary headache that gradually builds up over time. When this kind of pain comes together with nausea, vomiting, or a stiff neck, it deserves special attention. Even people with a history of migraines usually notice right away that this pain is different and more intense. In their own words, they'll often say, "That wasn't the migraine I know." Some patients also describe a sudden sensitivity to light or sound, or even seeing flashes in their field of vision. A sudden, severe headache like this, especially one that reaches an intensity the person has never experienced before, is considered a situation that requires immediate evaluation. Another important detail is that this pain sometimes comes with stiffness felt in the neck or shoulders. The person may have trouble tilting their head forward. If a family member hears someone describe it as, "It felt like something exploded inside my head," they should take that description seriously, because this kind of phrasing is something patients tend to use spontaneously, without exaggeration, and it usually reflects a real and significant difference from anything they've felt before. Number 5, loss of balance and sudden dizziness. Suddenly stumbling while walking, being unable to walk in a straight line, or feeling like the room is spinning can easily be mistaken for an ear infection or low blood sugar. Sometimes this symptom appears on its own, and the person assumes it's just simple dizziness. But when it's accompanied by a loss of coordination, walking as if intoxicated, or clumsiness while using the hands, the situation can take on a different meaning. Let's take James, a 71-year-old retired teacher. While standing in his kitchen, he suddenly lost his balance and had to grab the counter to steady himself. His family blamed it on his age, but when something similar happened again that same day, they went to the emergency room. James's son later recalled that his father had also been clumsy holding a glass that day and had to repeat a few words, but at the time, he hadn't paid attention to those details. This story shows that these symptoms sometimes only become meaningful when they're considered together rather than individually. When blood flow to the brain regions that control balance and coordination is disrupted, this kind of sudden unsteadiness can appear. The symptoms we've covered so far might feel fairly familiar. But now things get a bit more interesting, because the symptoms coming up next are ones that most people would never associate with a stroke. They seem like ordinary, everyday occurrences. Number 6. Sudden confusion and difficulty understanding. A person suddenly being unable to understand what's being said, unable to answer simple questions, or not knowing where they are, is often mistaken for old age or exhaustion. But when this symptom appears suddenly, with no prior warning signs, it can carry a different meaning. Some families only notice this change days later, looking back and saying, "Actually, something was off that day." Sometimes this confusion lasts only a moment. The person pauses in the middle of a sentence, forgets what they were about to say, and then continues a few seconds later, right where they left off. People around them might assume it's simple absent-mindedness. But these kinds of brief lapses, especially if they happen often or cause the person to feel confused even in a familiar setting, are worth taking seriously. A sudden and unexplainable mental fog is something both the family and the person themselves might notice, but it's usually dismissed with, "It's just tiredness, it'll pass." Number 7. Difficulty swallowing. Suddenly choking while eating or drinking, coughing, or having trouble swallowing is a symptom that often goes unnoticed, but is actually quite important. This difficulty can occur when the areas of the brain that control the swallowing reflex are affected. A person might simply brush it off, saying, "It went down the wrong pipe." But if this happens repeatedly or occurs alongside other symptoms, it's worth evaluating carefully. Some patients also notice a slight change in their voice along with the swallowing difficulty. Their voice may sound hoarser or weaker. When these two symptoms occur together, especially combined with a recurring choking sensation during meals, it should raise concern within the family and be shared with a healthcare professional. Difficulty swallowing can also lead a person to unknowingly change their eating habits. For example, some patients start preferring only soft foods because they have trouble swallowing solid ones, but they may not even fully recognize this change in themselves. Number 8. Unexplained, sudden, and extreme fatigue. Some people report suddenly feeling exhausted with no physical exertion to explain it. This is different from ordinary tiredness. The person feels as if their body has suddenly become heavy, as though their energy has drained all at once. This fatigue can sometimes come on so suddenly that the person feels too weak to get up from where they're sitting. Let's take Dorothy, a 69-year-old woman. While watering her garden, she suddenly felt so weak she had to sit down. After resting, she felt fine again and blamed it on the hot weather. But a few days later, a similar wave of fatigue returned, this time along with slight numbness in her arm. This second episode prompted Dorothy's daughter to take action and bring her to the doctor. These kinds of sudden, unexplained bouts of fatigue can sometimes be related to changes in blood flow in the brain, and if they recur, it's recommended to consult a specialist. This is especially worth noting when the fatigue has no reasonable connection to the person's normal energy level, meaning the person feels this exhausted despite not having exerted themselves that day. Number 9. Personality or behavior changes. This is perhaps one of the most overlooked symptoms, because it usually develops slowly and subtly. A normally calm person suddenly becoming irritable, restless, or indifferent might be described by their family as, "They've been acting a bit strange lately." In some cases, the person starts struggling with simple tasks they once handled easily. For example, they might mix up a routine they do every morning or get lost on a familiar route. Some family members initially interpret this change in a loved one as a natural part of aging. A mother might notice, during her son's weekly visits, that she's becoming increasingly hesitant and indecisive. Decisions she once made confidently now feel out of reach. Because these changes develop slowly, they're hard to connect to a stroke. But small reductions in blood flow to certain areas of the brain can lead to noticeable shifts in behavior and personality. Because of this, instead of dismissing sudden or gradual behavioral changes in a loved one as simply getting older, it can be helpful for families to share these observations with a healthcare professional. Sometimes this change shows up in an even subtler way. The person loses interest in things they used to enjoy, stops engaging in a hobby they once loved, or starts avoiding social situations. Family members often describe this as, "They've become a bit withdrawn," without considering that there might be a physical cause behind it. But these kinds of behavioral shifts are sometimes the sum of small changes that build up slowly over weeks, and only form a recognizable pattern when looked at in hindsight. Number 10. Persistent and unexplained hiccups. Now we've reached the surprise symptom we mentioned at the beginning of the video. Hiccups are, for most people, completely harmless, even a little funny. They're usually associated with eating too fast or drinking carbonated beverages. But in some rare cases, especially persistent hiccups that last for hours with no identifiable cause, this can indicate that certain areas of the brainstem have been affected. This region controls automatic functions like breathing and swallowing. Of course, the vast majority of hiccups are completely harmless and have nothing to do with a stroke. The ordinary hiccup episodes we experience in everyday life pass on their own within a few minutes and are in no way a cause for concern. But when hiccups occur alongside other symptoms, especially if they last an unusually long time, it can be a detail worth paying attention to. In particular, when this symptom occurs together with loss of balance, difficulty swallowing, or sudden dizziness, that combination deserves attention. Now, when we consider all 10 of these symptoms together, the overall picture becomes fairly clear. A stroke very often shows itself quietly, through small clues. Taken individually, these clues can seem unimportant, but when considered together, they become pieces of a much larger picture. According to a statistic frequently cited by health organizations, in the United States alone, approximately one person has a stroke every 40 seconds. This number shows just how common and just how serious this issue really is. So why is recognizing these warning signs as early as possible so important? Because when blood flow to the brain is interrupted, brain cells begin to die almost immediately. In fact, millions of neurons can be lost in just a matter of minutes. That's why every minute counts. One simple detail, knowing exactly when the symptoms first appeared, can help medical professionals make faster decisions about the next steps. If you ever notice these symptoms in yourself or someone else, try to remember when they started. It may seem like a small detail, but it can be incredibly valuable. It's also important to understand who is at risk. Conditions like high blood pressure, diabetes, an irregular heartbeat, smoking, and a lack of physical activity all increase the risk of stroke. But strokes aren't limited to people with these risk factors. They can also happen to younger adults and even people who appear to be in excellent health. That's why everyone should know the warning signs, not just those who think they're at risk. One question we hear all the time is, what should I do if I notice these symptoms? The most important thing to remember is that this video isn't designed to diagnose a stroke or provide medical treatment. Its purpose is simply to help you recognize warning signs. If you or someone near you suddenly develops one or more of the symptoms we've discussed, don't wait to see if they go away. seek medical attention immediately or contact emergency services. If you can, make a note of when the symptoms began, how long they lasted, and whether anything else changed at the same time. Those details can be extremely helpful during a medical evaluation. Of course, it's also true that not every symptom on this list means someone is having a stroke. A headache might simply be caused by stress. Fatigue could come from a poor night's sleep. Dizziness or balance problems can sometimes be related to an inner ear condition. But when several symptoms appear together, or when they come on suddenly and without a clear explanation, it's always safest to take them seriously and get medical help right away. Looking at the full picture, rather than a single symptom, is often what matters most. As you've been watching, you may have remembered something that happened to you or someone close to you. Maybe an older parent suddenly struggled to hold a coffee cup. Maybe a loved one briefly lost vision in one eye, had trouble finding words, or seemed unusually confused for a few minutes before everything returned to normal. At the time, it may not have seemed important, but now it might make a little more sense. If you've experienced something similar, we'd love to hear your story in the comments. Your experience could help someone else recognize a warning sign they might otherwise ignore. Simply sharing this information can make a real difference. Learning the warning signs of a stroke isn't about creating fear. It's about giving people the knowledge they need to act quickly when it matters most. A symptom recognized early can lead to treatment sooner, and that can change the outcome completely. Hopefully, after watching this video, you'll never dismiss sudden weakness, unexplained fatigue, difficulty speaking, or an unusual change in behavior quite so easily. That extra awareness could one day help protect you or someone you love. If you found this video helpful, please consider sharing it with your family and friends. And if you'd like more clear, trustworthy, and easy-to-understand health information, don't forget to subscribe to the channel. Thanks for watching, and we'll see you in the next video.